This virtual consultation is on how I use Kybella. Kybella, Kybella, is manufactured by Allergan. It's something that is used to dissolve fat. So people oftentimes use it in the neck because that's where people say it's going to work, but it doesn't. And the reason for that is we have to understand the anatomy. If you look at the neck, there's fat inside the muscle and outside the muscle. The muscle is the platysma muscle. So when you do it, it dissolves some of the outside fat, but not the inside fat. And interestingly, as we get older, we actually accumulate more inside fat, not the outside fat. And if the other problem is if you start dissolving the outside fat, that muscle starts to become more visible. If that muscle becomes visible, you need a facelift to fix it, which is a horrible thing to start with. Hey, I didn't want a facelift, I just want some Kybella. And the next thing you know is you have these saggy muscle bands and you need a facelift to correct that. So what I try to encourage my patients is, hopefully, in vast majority of cases, don't do Kybella in the neck. I don't think it works well. The second thing to understand with Kybella is where to do it. How do I use it? So I use Kybella in 3 circumstances, okay? Number one reason is jowls. So if someone doesn't want a facelift, but my facelifts are typically very easy recoveries and very effective, I can use Kybella to manage the fat in the jowls. I do it with very minimal risk and incredibly good results. That area here is an area that just responds very well to dissolving of fat. I oftentimes combine it with a little filler in the pre-jowl and the marionette, so the combination works incredibly well, but I can't tell you that it's going to be equal to a facelift. It's not. Oftentimes with 1 or 2 treatments, I've already managed the jowl, and so that's my number one go-to. I do every week, several times a week, oftentimes, to manage that area. The second area that I do as second most popular is overdone fat. So in areas that the cheeks are too big with fat grafting, other areas I find not perfect, but very good results in dissolving overdone fat. The other method I'll do is microliposuction, but if someone has an overdone cheek from fat grafting, I use Kybella to manage that. The other third one, which is less common, is lipomas. So if someone's got a lipoma in an area where there's risk of scarring, like in the hair-bearing tissue where I'm worried about, hey, that could leave a scar or the hair loss, I'll use Kybella. The problem with Kybella is it gets very expensive if you have a very large lipoma. So we're talking about large lipomas. It may be better just to have it cut out. But if it's a small lipoma where you're worried about scar tissue, this works very, very effectively for lipoma. So those are 3 indications, with jowls being that common, overdone fat grafting this common, and lipomas being less common in terms of what I use it for. The thing that you're going to Google and read about is that Kybella hurts a lot. For the first 90 minutes to 2 hours, there's a lot of pain, and that's simply not the case with me. Very dirty secret, put a little bit of lidocaine in there, you don't even feel the injection, and there's no pain in the first 2 hours. So in terms of pain, there's no pain. The biggest issue with the Kybella is that for the first week or so, it really looks a lot more swollen. For some reason, it swells a lot. It doesn't look great. I've had some patients complain even 2 to 3 weeks out, it still looks swollen. But what's interesting is that when I see them in person, I've done my own staff, it doesn't even look that swollen. Particularly if females are looking really close, they always think things are a little swollen. I always say you can come up with a white lie, which is, you had some dental work or whatever it may be. But the vast majority of patients, the worst is that first week where it looks more swollen. I've seen results as early as 2 weeks out, but oftentimes it takes weeks to about 6 weeks for that area to get tighter and tighter and tighter and tighter. And so that area here really takes about 6 weeks to shrink down. How often am I needing to do it twice, 3 times, 4 times? Because you're going to Google that, they're going to say you need it 4 times, 5 times. I would say 80% of my patients do it once, the jowls, and 20% do it a second time. So same for fat dissolve for cheeks and other areas. Oftentimes is 1 and done, sometimes 2. Now again, it doesn't equal to a facelift, doesn't equal to perfect results where there's no jowls, but it's a great way for someone with a little bit of weight gain or early jowl increase to do this. Now the way that Kybella works is actually it's a detergent that breaks down and lyses the fat cells, and the fat is absorbed. So it's like permanent liposuction. It's gone forever. The skin then tightens up around the jowl. It doesn't actually sag in this area. For some reason, it just shrinks up. So, and again, it's not equal to a facelift. But this is how I use Kybella and how I don't use Kybella.